I'm Dr. Choi. I'm a specialist in gout research. I work as a rheumatologist and professor of medicine at the Boston University School of Medicine, where I see many gout patients. If you have a gout, you may already know that condition can progress if left untreated. This may lead to chronic persistent pain, serious joint damage, and tophi, which are disfiguring lumps of crystals under the skin formed from uric acid. Another very important thing for patients to remember is that gout is not gout alone. Gout has a lot of bad friends, meaning there can be other serious health conditions associated with it, such as high blood pressure, heart disease, kidney conditions, and even the risk of premature death. Therefore, if you have a gout, you need to take care of your overall health as well. This holistic approach of considering gout as well as other related complications is very important. That's why lifestyle measures can make a big difference in individuals with gout over the long term. A big step you can take if you have a gout and you are overweight is to cut calories and exercise to help shed pounds. Achieving an appropriate weight for your age, height, and gender can lower your uric acid levels and can reduce the risk of gout attacks. Furthermore, losing weight will help reduce your insulin resistance and improve your overall health. Exercise is important for people with gout because it also helps to reduce insulin resistance, which in turn aids in lowering your uric acid levels. Exercise is beneficial in all kinds of other ways too. It helps prevent heart attacks for one, and also helps you live longer, so it's very easy to recommend. Of course, I also recommend healthy eating, but not the typical low-purine diet doctors used to emphasize. What you found is that trying to stick to a low-purine diet is very difficult over the long term. And in the process, you can cut out some foods that are good for you to help prevent other major conditions like heart disease or diabetes. If you have a gout, focus on eating balanced, heart-healthy diet with plenty of fruit, vegetables, whole grains, healthy proteins, and low-fat dairy products. However, you should avoid eating red meat, limit amount of alcohol you drink, and stay away from sugary sodas as they can lead to higher uric acid levels and increased gout risk. It is important to have ongoing communication with your healthcare team about how your condition is affecting your personal and work life. It is critical for your doctor to guide treatment and make recommendations to help you manage your symptoms, reduce frequency of attacks, and prevent impairment. You must also realize you are not alone. It is important to communicate with family, loved ones, and employers to help explain your condition, how it sometimes affects you, and what they can do to help. Remember, when it comes to tackling gout over the long term, you need to take care of your overall health as well. This means shedding pounds if you are overweight, exercising, and eating a balanced, heart-healthy diet. This, along with the communication with family, co-workers, and your doctor, will set you up for a long-term success.